Hi everyone! I'm a functional medicine provider specializing in thyroid health. And today we are going to talk about what is autoimmune thyroid disease. So if you're new here, welcome. We would love to have you hit that subscribe button so you don't miss any of our upcoming videos. So let's dive right into it. What is autoimmune thyroid disease? The first thing I want to say is that autoimmune thyroid disease is an umbrella term that includes both Hashimoto Thyroiditis and Graves' disease. And today we're going to focus primarily on Hashimoto's. But this information does apply to Graves' disease as well. So when we look at what causes autoimmune thyroid disease, there is not just one single cause. There are multiple factors that come together that make a person susceptible to developing autoimmune thyroid disease. The first factor is genetics. So if you have a family history of autoimmune thyroid disease or other autoimmune conditions, you are more likely to develop autoimmune thyroid disease. The second factor is gender. So women are 7 times more likely to develop autoimmune thyroid disease than men are. This could be related to hormonal changes during pregnancy or menopause, but it's not entirely clear. The next factor is iodine status. And we know that most people in the US and UK and many other parts of the world are actually iodine deficient. That can trigger the development of autoimmune thyroid disease. The next factor is stress. And chronic stress can definitely play a role in the development or progression of autoimmune thyroid disease. And lastly, gut health. So if you have any type of gut inflammation or any type of gut issues, that can increase your risk of developing autoimmune thyroid disease. So how do these factors come together to cause autoimmune thyroid disease? Well, if you have these genetic variants that make you more susceptible to autoimmune thyroid disease, then you're going to need that second hit to push you over the edge into developing the disease. And this second hit can be triggered by those other things that I talked about, like iodine deficiency, stress, gut inflammation, etc. So for example, if you're genetically predisposed to Hashimoto's, but you don't have any of those other triggers, you're probably not going to develop Hashimoto's. But if you have that genetic predisposition, and you also have gut inflammation, for example, then you may develop autoimmune thyroid disease because those two factors have kind of pushed you over the edge. How does Hashimoto's develop after that initial trigger? Well, what happens is your immune system starts to attack the thyroid gland because your body identifies the thyroid as being the threat. And the thyroid, because it has been signaled as a threat, starts to develop these nodules and it becomes enlarged. And because all of this is happening underneath the skin, you can feel these nodules, and that's how goiters develop. Your thyroid is trying to compensate by getting bigger so it can produce more hormones. But as these immune cells continue to attack the thyroid, it eventually reaches a point where the thyroid can no longer compensate and the thyroid hormone production starts to slow down. So Hashimoto's is really this inflammatory process that is causing the thyroid gland to slow down. So unlike Graves' disease, where the immune system is stimulating the thyroid to produce too much thyroid hormone, in Hashimoto's, it's the opposite. It's an autoimmune process that is causing inflammation and subsequently causing the thyroid to slow down. So I hope that was helpful in explaining what exactly autoimmune thyroid disease is, how it develops, and some of the things that can contribute to its development. If you have any questions, please leave them in the comments below. And I will see you in the next video. Bye for now.